and we'll see how that works.
Well, how are you, Dr. Finch?
I'm doing well. How about you?
I'm doing very well. I'm glad to be able to do this with you. We have such history going way back, It's nice.
Yes, yes.
So this
Um,
summit is about a unified vision for all the different avenues of both high school recovery, drug courts, um, collegiate programs, any kind of advocacy organization. And from your vantage point, what comes to mind when you think about all these people coming across in the same system that is summarized by awareness, collaboration, advocacy?
well, I think collaboration really is the key. I think we have to find ways to work together across sectors. I think one of the things that has hampered uh, many movements, but I think especially the movements within addiction and recovery, has been that it's become very siloed.
Exactly. Yep.
Forever, it's either been focused very specifically on, say, one substance, and one substance is treated different from another, or it's treated very differently based on uh, a government sector. Education works with it, or SAMHSA and mental health work with it, but they don't work together. And I think that's the one piece that's been missing all these years. And I think the efforts recently to cut across those sectors and bring those groups together is important. I think we're in the early stages of it. I think one of the reasons the sectors haven't always worked together well is they don't understand each other. They all have their own ideas about how things work. But until we try it out and until we sit down together and learn about the other, we'll never have that chance. So I'm excited about at least the beginnings of that.
Yeah, I think you're totally right. I mean, it's almost like dealing with a person as a whole person. We have one little piece of it, and then somebody else has another piece, and all these different professionals. And then when you put them all together, you can really understand a person. It's the same with this. And the goal of not being siloed, you're right. We're on the verge of that right now. You mentioned that there are a lot of structural similarities across the models, length of engagement, types of support, things like that. What research opportunities or questions come to mind when you think about this, it being on the verge of a good collaboration here?
Well, I think there's many levels of research that have to occur. If you go back 10, 15 years, uh, there was hardly any treatment outcome research for adolescents.
Right.
There really wasn't a lot of treatment outcome research, but the younger the person, the less research there was. Thankfully, we've seen that change some. We've seen a lot more treatment outcome research over the last 10, 15 years, but we haven't seen a lot of focus on the different types of environments where young people have their recovery supported, whether it's a school environment, workplace, home. Uh, a lot of the research is pretty basic. 12 months after treatment, these are how adolescents are doing. And so I think we need to understand the different environments that young people are in when they're getting clean and sober, and how each of those environments impacts a person's ability to stay sober. And I think young people, we've known for a long time that we can't just take adult models and apply them to young people. Their circumstances are very different, whether they be in high school or in college. We can't just apply that same frame. And so I think we need to understand the environments that young people are in, and then we need to understand how those environments work together to support their recovery.
Yeah, I agree with you. I think that's right on. What about are there opportunities for technology transfer in these different approaches?
Well, sure. I think as more and more people start to provide supportive services, they need training in best practices. And
Right.
I think for a long time we've been in this mode of evidence-based practice, and making sure that we're using evidence-based practice. And I agree with that on the surface. I also would caution people that there needs to be room for innovation. If you're talking about a group of people, young people in recovery, that we don't know a lot about what works best, then I think there needs to be some room to try things out. And I think especially in schools, high schools and colleges, it's different in every community and every college that you're in as far as how it fits, what services you can provide, who those young people are. And so I think there needs to be some room for innovation before we just close it down and say, well, you're not doing an evidence-based practice.
Right.
Well, if the evidence base was built on a group of people that's very different than the group of people you're serving, then it's likely not going to work or not going to work well.
Right.
But once we have more and more evidence built up, then hopefully the new programs will utilize those practices that have been shown to work. But we shouldn't get too bogged down at this point, closing things down because they're not using some type of prepackaged, tested program. They need to learn from the people around in the country and see what might work best in their program.
Exactly. I support that wholeheartedly. I think we're only as good as our creative minds. As much as we can be creative to help young people and others, you're right on with that. What methods and approaches would you use to move forward on the research and the technology transfer?
Well, I think they're related, but I also think they're separate. I certainly think the research needs to be done, first of all, to describe what programs exist. And I think we've seen some of that. Some of the work I've done with Dr. Paul Moberg, University of Wisconsin, to describe the high schools. Some of the work that has come especially out of Texas Tech, describing some of the college programs. I think as we understand the programs that are out there and are clear what services they're providing, then we can start to look at outcomes from those programs. And I think that type of work is in its beginning stages. There are a few projects that are going on right now. I think there needs to be a lot more. And then as we look at the training, hopefully the training will be informed by that research, but not limited by that research. And so this idea of innovation, I think the way that we encourage innovation is we need administrators and we need policymakers who are first of all believing that recovery support is part of what they do. So speaking specifically about schools, we need college administrators who say, we believe that our campus needs to be supporting the recovery of the people on our campus. And in a school district, we need school districts to acknowledge, yes, substance abuse is an issue in our community. We are going to provide services that identify kids who have a problem and who have an issue. And we're going to have a continuum of care that we're going to support in our school district. Now, that seems logical to the people that are watching this video, but as you know, Patrice, it's an uphill climb still for college administrators and for school leaders across the country to understand that. It makes me scratch my head why they still think that's confusing. But again, it is. And I think until they acknowledge that that is part of the role of our education system, I think we're going to struggle. But once they do, once they've acknowledged that, that's where the technical assistance comes in. And that's where I think that the programs, especially ARHE and ARS, that are set up to provide that technical assistance. The experts are there. And whether or not our systems are well developed to do that, I think the people are in place. And I think that's where support can come. What support does ARHE need? What support does ARS need to develop the systems to provide that technical assistance to high schools and colleges? So when they're ready and when they're saying, we want this,
right,
that we can come in a systematic way and help them do it. And that's been done well in some cases, but in other cases, I don't think that the systems have been in place to do it well. And
right.
I think that's probably the next step in technical assistance.
Yeah, I think too. I mean, would you say that stigma is still the number one issue with the administrators of both high schools and collegiate programs, or do you think it's greater than that? Why
I certainly think
like
I think there's a number of things. I certainly think stigma is an issue across the board. I think there's stigma in communities and families, and I think that's going to be a very difficult piece to get rid of. I just think the nature of addiction and what happens in families and communities when people are using, it causes people to be afraid to acknowledge that that's part of their issue. And so I just think that stigma is going to exist. But I also think there's a lot of debate that's going on right now about what is addiction. You know, even with substances, you know, are these substances really addictive? Do young people really need to abstain? Could they just use less harmful substances? And it's interesting because I think that debate's been going on a long time as well. But I think it's getting a lot more nuanced. I think people are getting the backing of more neuroscience research, and I think they're getting more studies that are I think clouding the discussion about what's best for young people. And again, I I watch that happen, and I think that confuses administrators. So I think when administrators and leaders say, "Oh yeah, we want to address the substance abuse issue," I think the debate that's happening right now about, well, can young people really be addicted? Is this just a behavioral issue? Do they really need to stop using substances? I think that debate slows things down. And again, I often feel like we're putting these adult models, and when I talk about adult, I'm not talking young adults here. I'm talking, adults 30 and up. I think young adults I put in a different category, but I think high school age kids and young adults, I'm not really sure we should be having this discussion about uh, uh, are substances harmful. I think especially for teenagers, they're going to be, and I think we need to help young people learn life skills and social skills and build friendships and healthy peer groups without being impeded by substances and without getting caught up in this debate about, well, maybe it's okay to use these substances. Because I think with teenagers, the illicit substances that are out there are not going to be helping them develop their social skills or helping their brain develop in its healthiest fashion. And we get caught up in these philosophical debates about the harms of the substances, and I just don't think that's helping young people at all.
And actually, while we're debating, hundreds and thousands of kids are dying certainly from the opiate crisis that we have right now. And obviously you've known from other things too. When you think of support tools, are there other things besides electronic, or what would be the electronic support tools, technical support tools, and are there other things that we could be using to help bring drug courts, treatments, the various groups that you mentioned together?
Well, yeah, I think one of the really exciting discussions that's going on right now is how do we stop throwing people into prison because of their alcohol and drug use? How do we stop making things worse for them? And I think, the debate around legalization, I think, is a really interesting one. And I think when people use examples of countries or societies that have legalized or decriminalized substances, I always get concerned if they don't include as part of that discussion more resources being provided for treatment, prevention, continuing care efforts. Certainly, throwing a young person into jail or taking away their college funding because of their substance use, that doesn't seem logical at all. However, not providing them a consequence and not providing them access to some level of treatment also seems just as irrational to me. And so my hope is that when I talk about sectors working together, that we can not only get the treatment sector and the education sector together, but we can get the justice sector together, and we can make decisions that say, okay, we might pull away from the jail and that type of punishment, but we'll replace it with levels of care and treatment that are indicated by that person's issue. I think that's the other part that we have to understand, that addiction is a progression, and things start with problem use. And if we can identify problem use early, then we might not need the full scale level of treatment for everyone. But we have to identify it early. The other thing is, we shouldn't avoid more intensive treatments for people for whom it's warranted. And everybody is not going to be served by a short-term brief intervention. If you catch it early enough, that's going to perhaps work well.
Right.
It may not. And I think as things progress and get worse, I think we also have to have treatment access for people for whom it's gotten worse. And I think that's the other part of the discussion that gets lost sometimes. When research starts to show that brief interventions work really well, you have to read down deeper into those studies to realize it doesn't necessarily work as well for people that have a more severe issue and a more severe problem. And I think funders, policymakers, program developers need to continue looking at more intensive programs and long-term programs for people that have developed a much worse issue.
I agree. And I think in listening to you, certainly some of the people that will be in the room for the summit here, insurance providers, that's a perfect message to them as far as it's not a cookie cutter approach. It's not 28 days for everybody. It's different for lots of different people. When you think about the lessons over the years, what lessons have been learned, and then what lessons can be disseminated to various groups?
Well, I think one of the lessons that thankfully we learned is that this is not a straight line approach to helping people. In other words, we don't treat people and then they get well and then they can have a little bit of aftercare and they will be well the rest of their life. I think the idea that addiction is chronic and cyclical, that people go through periods of sobriety and then periods of relapse and use again, and that this can happen across a lifetime. I think that part is something that has been a big advance in the field, because I think it also says we have to continue to support people for a long time. I think the other piece about that is that the continuing care part of that has grown in importance. We've understood that treatment is really just the beginning. If someone actually receives alcohol and drug treatment, they need support after that to continue the gains of treatment. And they may need to return to treatment again, but I think whatever happens long term as people get back into their lives is actually perhaps the most important part. And I think one of the big discussions about treatment over the years has been, well, you're taking people out of their environment, you're giving them all the support. Is that really what they need? And I think certainly people are going to benefit from that, but it is indeed what happens long term when people are back in a community, when they're surrounded by people who may be using drugs, using alcohol, and they have to learn to live. That, I think, is really getting some focus now. We used to be an afterthought. It used to be, oh, well, if they go to aftercare, if they go to maybe a 12-step meeting, that's what they need. I think we understand it's a lot more than that.
Right, and I think that speaks to the issue for schools. I mean, we're not taking them out of their system when they're in these schools, getting the support they need with their peers, which are so important at that stage of their life. So it makes perfect sense. You were at the core conference, Andy, when this conversation started down in Florida, and then now North Carolina is the first state to continue the conversation in this context of a summit. What would be your charge to these groups that are really coming together to bring awareness to the subject, collaborate with each other, and hopefully advocate for everybody to be working together on this issue? What's your charge to us?
Well, I think if I were to go into any state, I would want to survey the landscape and say, what services are we providing? What's accessible? And what's missing? And I don't think it's a simple matter of saying, oh, we provide that service. I think we have to look and see who's accessing that service and who is not. I think that when we look at a state and we go, oh, they have a recovery high school, or, oh, there's that one college campus that's providing a really good program. And let's use Minnesota as an example. I mean,
Sure.
let's say the Step Up program was the only program in that state. Now, I understand there are more programs. Well, let's just
Right.
use this as an example. Well, that's located in the Twin Cities. If you're
Right.
across the state of Minnesota, that's a long way from home. And
Exactly.
similar at the high school level, there used to be 16 high schools in Minnesota. Now there's only 4. And so it's a lot more difficult to get to those programs. So
Mm-hmm.
we could look at Minnesota and say, well, gosh, 4 recovery high schools is still more than most other states have. They must be doing well. But again,
Yeah.
when I go across the state and it takes me 3 or 4 hours to get to one
Right.
of those, I'm not going to go to it. And so I think in North Carolina, I think it would be very important to survey the landscape and say, first of all, what services are being provided in our high schools and our colleges,
Mm-hmm.
but also who has access and who doesn't. And
Right.
if we look at those programs and realize that it's a pretty homogenous population that's using it, and when I say homogenous, it could be anywhere from high income to low income. It could be one particular race is overrepresented, one particular gender is overrepresented. If we see that, then that identifies the gap. And then I think we need to ask ourselves, if we think this is a good program, then how do we make it more accessible to people who aren't here? And that could be a geographical solution. It might mean just opening up more programs in different areas. It may be something more internal. Do we need to staff it? Do we need to market it differently so that
Right.
more people want to come? But I think with any state, I think it starts with looking at the services and making sure that you have services across the continuum and across sectors, and
Right.
that the sectors are working together and not against each other to provide those services, and then make sure that people are actually being able to access it across different demographic groups. And that's the starting point.
Yeah.
Thankfully, there's people to help.
It's so wise. You just laid it out there for us, and I really appreciate that, Andy. I think our time is up at this point. It's great to see you.
Thank
Always
you.
great to talk to you, and thanks so much for the interview. And we'll keep you posted on how the summit goes.
Great. Good to talk with you, Patrice.
All right. Take care, Andy.
Bye bye.
Bye bye.
Okay, let's hope
Yes.
that
And
recorded. Let's see if I can find it here. Um, it's somewhere on my computer. This is just not something that I. All right. Stop screen recording.